We're thankful to all who are joining us today. We're well over 50 participants now, and it is still climbing. We're thrilled to get such a good turnout for today's session. I'm Eric Carlton. I'm Associate Dean for Professional Programs and Director of Graduate Studies for the West Virginia University School of Public Health. Among those programs is our new Master of Health Administration program that we launched in fall of 2020. Launching a program in the middle of a pandemic was no small feat, but we've had a great team and great support from the university as well as from our partners throughout the state. One of those great partners is the West Virginia Hospital Association. And we are pleased to be able to present today's session at Administrative Ground Rounds focused on resilience and well-being, something that we are all facing in the midst of this pandemic, as well as what we faced prior to and what we'll continue to face afterwards. I'm grateful to Dr. Kaufman and his support, his partnership in helping put this session together. I also want to recognize our MHA executive in residence, David Woodrum, and our professional program manager, Kara Forrest, who've been so instrumental in making this session possible. I'm going to turn time over now to Jim to introduce our speakers and provide you the framework for today, and we'll turn the time over from there. Again, we welcome you to the session and ask that you mute until the time is right. Thank you.
Eric, thank you very, very much. And first, I'd like to welcome everybody to this session, Preventing Burnout and Building Resiliency, Tools and Techniques for Healthcare Managers. I think everybody would agree one of the biggest challenges we have is ensuring a strong, vibrant healthcare workforce. And I think we would all agree that COVID has produced a lot of challenges for a workforce that was already stressed out well before. We have a great panelist today, but I also want to, before I introduce our panelists, want to thank the West Virginia University Masters of Public Health program, Masters of Health Administration program for their support and partnership in this webinar. So our three panelists today, first, I'd like to introduce Heidi Edwards, who's Vice President of Professional Practice and the Chief Nursing Officer at the Charleston Area Medical Center. Then Dr. Art Hengerer, who's the past board chair of the Federation of State Medical Boards and a member of the National Academy of Medicine, who's joining us from Maine today. And then Matthew Murray, who's Vice President of Operations at the Orchards in Chester, West Virginia. The way we'll do this is a great topic. We have a lot of great material to cover. After our three panelists will do their presentations, we'll open it up for questions at the end. However, if you would like to use the chat feature, please post your question at any time during this. With that, Art, I'll turn it over to you.
Very good. Thank you, sir. So first of all, I want to thank you for the opportunity to spend the next few minutes chatting with you all and sharing with you some experience that I've been working on really related to clinicians. And I use that term to apply to physicians, nurses, and all the supporting staff that are involved in our institutions and are dealing with trying to find their resilience and maintain their well-being. There's no disclosures that I have. And at this point, we're going to spend some time here talking about the presentation of a little bit about computer power and how that's impacted our lives, some issues around the tensions and so forth that exist between the different parts of our healthcare system, the resilience and commitment of the workers and what's going on for them during COVID, the impact of loneliness and gratitude effects on all of this. And then what do we do to try and find ways to support ourselves and gain some recovery? So as we start off, this is a very interesting chart that I found in Tom Friedman's book, Thanks for Being Late. That when I looked at really set very well in what I was talking about so often. And that's Mr. Moore, who was one of the founders of Intel, who said way back in the early 1960s that every 2 years the computer chip was going to double in its capacity. And lo and behold, right up until present day, that fact has held true and has become Moore's law. And then if we look at this graph here, what we see is that that technology then continues to escalate in its productivity, and it's now really past human adaptability. And we haven't really kept up with that in terms of how we've been educating ourselves, how we as leaders have been taking on to prepare those that are dealing with this to a level that we really need to. And so if you think about that, what's going on, systems and government has used all of this technology and put requirements forward that's really begun to impact us in terms of the connectivity that's required and expectations of our work hours, how it impacts our downtime and our family time, and how the incrementalism of it, so that it gradually creeps in and overtakes us. And COVID has even added to that. So for some reason, there we go. So if we spend some time talking about this concept of burnout that became so prominent back in the previous 8 or 10 years, and we knew how it was affecting so many of us as healthcare workers, and the 3 factors of emotional exhaustion, dysfunction in terms of our behaviors and the empathy towards our patients that we were caring for and our other staff members, and a feeling developing that what we were doing really wasn't mattering in our involvement in our workload. And so it fluctuates depending on where people are in their work and in their careers. And when we start looking at burnout, what we find is it's not really just a problem where you just come up with an answer and a solution. What we're finding is that it's what's called a dilemma. And when you have a dilemma, you have to have a perpetual balancing act to figure out how you're going to deal with that, requiring you to develop different action plans and habits that you get into. When you start looking at this dilemma, what came to light is that there's really 2 strategies that are going on within our system. One is that there's the personal strategies that we as the individuals had to come up with to deal with our resilience and how we worked within the culture that we were living within. And in so doing, the reason for that was we were trying to really maintain our cognitive performance so that we were being effective in the care we were offering. And originally that was really thought this was the big problem with burnout, but it turns out that really isn't the case. The real big problem is what goes on with the system design that we all have been having to work within. And those of you who have looked into this often know about the triple aim that came to light, which was talking about the cost of delivering care, what services you were trying to provide, and how satisfied the patients were with what they were receiving in terms of care. And really very little time was being spent looking at the individual who was providing that care, and began to really create a huge amount of the problem. So what is the resilience we're talking about? Well, it's that innate trait that we all have to some degree, which helps us bounce back from when we're facing adversity. And so if you look over here in that left-hand column, you see all of these different ways that people use to try and manage that issue and become resilient. And you're doing it because there's 4 main areas in your life that you're trying to manage. One is just your mental capacity and how you deal with your day-to-day working environment in life. And then how you control all that activity emotionally to do it effectively. And thirdly, that you maintain some level of physical health and well-being, and utilizing whatever spirituality you do to keep all this in focus and on track. And this is what gives you this work-life integration that we talk so much about. And what we found is that started to happen with the pandemic was that the social breakdown and inequities that were starting to happen, that individuals didn't have the same abilities and characteristics to manage their resilience, and created a whole lot of difficulties and problems. So then the next terminology that began to come to light was this term that was called moral distress. And what happens here is that people start to try and maintain their resilience. But what goes on is that what you're starting to see is, and especially as we got into this pandemic, was that there were a lot of core values and ethical issues that were coming to light for individuals that they were having trouble dealing with, and really started to create some problem for them. And the moral distress is really this issue that you know what the correct action is that needs to go on as a professional, but you were being blocked from taking those actions because of various things that were going on within the system or culture you were working within. And what that does is, when that goes on long enough, it starts to create what's called the moral injury. And when you think about what many of us within this pandemic have been living with, is that it's not only those ethical issues and your own values, but you were being put in job situations you weren't comfortable with. There was a lot of fear that came in of your exposure to the illness and disease. You had a breakdown among those that you were working with. And so all of these things began to build up and create this what's called moral injury, where you know, as you watch those that were in legitimate authority above you making decisions that weren't right, or you got put in a situation where you had to make a decision that all of a sudden you weren't comfortable with and were saying, oh my gosh, I did that. And that began to start to impair your capacity to really carry on and cause you to begin to suffer and break down. And when this kept going on over and over again, or does keep going on over and over again, you start getting this distress from these recurrent events that are happening that integrate into your thoughts and views and really distress you morally and create a long-standing problem. So the other thing that we're dealing with right now is that we were spending a huge amount of time thinking and talking about burnout for individuals within our healthcare systems. And as you see there on the right, that was where your emotions were blunting down. People were becoming somewhat depressed and distressed. Their emotions were being affected by this. And many of the people really weren't always cognizant of what level of problem they were having from that. But we tended to focus there to that side rather than spending time thinking about the stress that came into play with this. But when the pandemic hit, now what happens is the stress mounted up again. And here we see that's an overreaction, very anxious. You recognize the physical problems you're having internally as a result of that. And you understood that, but you didn't have the burnout going away. So this back and forth of these type of emotional factors that were happening. So when we think about then having this moral injury and all of this distress and so forth, there's lots of different things that start happening to us as an individual. And you see many of them listed here, that just how we respond in not taking care of ourselves, being somewhat reckless. Our behaviors become altered. Some people, unfortunately, get into substance abuse. There's social inequities and how they relate to people. But one thing that's really important that's coming to light now is the degree of loneliness that exists. And when we talk about and think about loneliness, there's a great book available written by Vivek Murthy, our present Surgeon General, called Together, where he spends most of the time in this book talking about this factor of loneliness, our separation away from people, feeling abandoned, cut off, all of those things that as we look at what's been going on with the pandemic comes to such intense light to it. And he points out that the seriousness of loneliness and its effect on a human being is equal to 15 years of smoking in terms of the bad outcome. So it has huge impact. And he talks about the three different dimensions of loneliness that we experience because we're tribal people. We need that contact and be together. So he talks about the intimate, the relational, and the collective types, which are going from that very intimate, trusting, constantly sharing of that life with your individual or significant other to very long-lasting, important relationships, or those that exist in a working environment and how they've been altered. Now, if we think about loneliness, one of the things that's been recognized is we all tend to think we're lonely. We don't think about it in terms of, oh, maybe somebody else is lonely that you're working with or you're living with. But we all have some level of loneliness. And if we don't think about that, spend a little time recognizing within ourselves what's going on with us personally, then we're not ready to go out and share and be supportive. It's very important, especially those that have good family connections, that those are important relationships to enhance, and also developing habits within the work environment that you can work on to strengthen not only yourself, but those in your peers and leadership within the institutions you work within. So those are very important factors to be aware of. And when we talk then about the personal steps of this, you have to be aware of this or you're not going to work and deal with it. So the other thing that we tended to put aside in many instances as we became so separated from one another and not engaged the way we necessarily should be is we forget to thank people the way they need to be, just like we want to be recognized and appreciated for what we do. And when the neuropsychologists look at this, what they find is there's huge benefit from recognizing and giving gratitude to others, that it really does boost one's happiness, the stress levels drop, the level of depression that's occurring can be documented and shown, people sleep better, the level of PTSD drops down, the social support that goes on is helpful, and the more resilience that one has, the better it is for challenges in our life experiences. So there's huge benefits to gratitude that we haven't necessarily spent the time to that we needed. And all of those things become so important in finding joy that's needed in the workplace. And if we look at Maslow's hierarchy of needs, we see all of those different things that get talked about here that we've just been talking about as it relates to moral injury and loneliness and so forth. And all of those factors mount up on one another and come into play. So if we sit then and we think about this as human beings and how we're being affected by what's going on, then we look at what we've been experiencing over the last 18 months or so and how we've been responding to that. And we all know, because we've been working online with what's been happening with the challenges that have come from this COVID pandemic in terms of the delayed responses that happened at all levels within our society, from government to health systems and various other entities. All the misinformation that's created so much problems within decision-making in our society. Those of us working, caring for these individuals, the constant changes that have been going on in protocols and treatments and recommendations, now how we distribute vaccines, who needs them, what ages, what have you, and this continuing issue back and forth between the political influences and the public health policy that's out there, as well as trying to maintain some economic stability at the same time that we're dealing with the various social issues. And so we have to have awareness of all of this, and then all the DEI that's come to light that we also continue to work on. So as we think about this challenge then, there's multiple things going on within this pandemic. We still have all the burnout issues, and studies now are showing that the level of burnout has increased actually be above what it was back in 2019. Some studies are showing 60% of physicians are manifesting this, and the nursing corps also has dramatically increased. We're dealing with just the basics of the COVID viral infection, and then this financial crisis that's been created, and it's having definite effects both physiologically, psychologically on individuals, especially those that are having trouble managing their level of anxiety and stress. And the reality is we can't really separate these four different things that are all happening. And when you're facing these kind of unprecedented threats, we all start having responses that tend to be unprecedented. The one thing, though, that we always have to keep in mind is that the one thing that we as individuals can do for ourselves is make sure that we're managing our own anxiety and stress that we're facing and going through. So let's talk a little bit about then this anxiety, this stress, how it's all behaving. So this is a graph that you see before you that talks about any disaster that occurs. It doesn't matter whether it's a bad flood, a hurricane, tornado, or the pandemic. And when these things happen, there's a certain emotional level that exists within the society and the individuals that become exposed to this. And as you recall, after it happened right away, there was this heroic response that started happening for healthcare workers, first responders, and so forth, all over the world. Most of those individuals, yes, they appreciated it, but they didn't want to be considered heroic. They wanted to be considered human beings doing their jobs, getting things done, and moving things forward. And this did go on for a period of time, but you're not seeing that happening now. There's been this drop off into the disillusionment phase that starts to occur. And we see, just like with the pandemic, this goes up and down to some degree with the different waves and stuff we've been seeing. Most of these type of disasters, within a year, things have stabilized, people are getting into recovery mode and so forth and getting through the grief they suffered. We aren't there yet with this pandemic, and it's what's adding to much of the problem that's been happening. And when this is going on and occurring for each individual person, there's a level of psychopathology that exists and tends to be occurring. And as we see here in this slide, there's a pre-trauma vulnerability. And what that is were you exposed to some previous event of this severity that affected you? Mental health issues you may have, previous substance abuse issues, poor family dynamics. So all of those things are going to have an effect. Plus, how exposed were you to this particular event of the pandemic in terms of your work environment or family? And all of that over what is your baseline resilience that you have to deal with this? So if we look at all individuals from this point of view, what you see is there are these various responses that are going to happen to every individual that comes before this. Some have just a distress reaction, as you see listed here in the orange colors, where they have some sleeping issues, they're irritable, they have some somatic complaints and so forth. But for the most part, their resilience is pretty good and they handle this pretty effectively. But there's some people that had significant psychopathology before the event occurred. Those people may end up hospitalized, as you see with these various type of things listed in the green, and have long sustained difficulties. But almost all of us have some type of health risk behaviors that will happen. As you see here, a little bit of addiction or poor judgment behaviors that happen, some family distress that comes into play, or interpersonal conflict and so forth. So all of these different issues can occur. So there was a study done of about 250 people involved out on the West Coast, Northwest, that they looked at very specifically. They'd been very involved in caring for COVID individuals, and they had these 13 questions. We're not going to go through each, but there's 3 different categories. There were those questions asked about how much volume they were exposed to in terms of the care they were giving. What type of depersonalization did they feel from their work environment? And thirdly, how much risk did they feel they had from taking on the exposure and so forth for themselves, their workers, and their families? And so what came out of that was, if they looked at this entire population of workers, every one of them manifested some level of mental health impact, whether it was they couldn't be retained in the job and left, the level of function of their performance was altered and affected, or even up to the level of suicidality. They found that the strongest effect was PTSD was being manifested in a certain group of these individuals. They then looked at those 3 different categories, and what they found was that the biggest impact for causing some type of mental health response was the demoralization that came from the work environment they were working with. And they found that those who manifested some specific PTSD symptoms, that the best way to get some indication that that was happening and the severity was how intrusive the thought processes were through the day of what they'd been exposed to and how bad their sleep pattern had been affected, which would give them an idea how long this was going to go on. And as we see here, those different symptoms that they had, high level of PTSD, depression, anxiety, lots of difficulty with sleep that required utilizing something, and the likelihood that they felt from what they were learning and finding was this was going to be a fairly long, sustained response that we were going to be dealing with. The other thing that comes to light is the responsibility of leadership in trying to work through these issues. And what we know is that leadership is not just that titled position that somebody receives. It's really the willingness to get into the involvement of what's going on, see that you're present, see that you can set examples and encouragement, whether you're the CEO, a department chair, a team leader. All of them have these roles to play, seeing that you're being transparent and honest with your workers about what's going on, and try and normalize things as much as you possibly can and give them hope that you see that things are going to work out and that you're not just trying to solve these problems because you're trying to fix it for yourself. You really are there to be a leader and supportive. And it's important to acknowledge the grief that people are feeling because everyone has that and they need to understand that it's very appropriate for that to be occurring. So as we finish up here, if we start talking about this, what are the important things that you in these positions that you're here representing today and your work, wellness is really starting to come to the top as a value that's essential for you and the culture to move forward and make it also available that there is confidential mental health access for those people that you're overseeing or working with and caring for. Because you can't deny that this is happening. You can't deny the pain that it's causing, and you need to be there to discuss and work with them to seek the help they need. It's important if you are in frontline activities that you need to be willing to become involved and be a decision maker with those that are working on it. And you need to realize that you can't control everything. So figure out the things that you can be helpful in and really put your effort to, and choose those things that can be sustainable in your culture to show success. You need to also understand that this healthcare system is still cost-driven. So there are going to be some constraints in achieving the wellness you're looking for, but still there are lots of things that you can begin to work on and do. And it's important that you recognize right now the urgency of doing this to take advantage of this effort going on towards wellness and how COVID and the pandemic has had an impact. So if we think about the systems we're working in, it's only fair as we as clinicians understand that all of our healthcare professionals have gone through this, but also those that are leading these systems, the administrators, they've had the same kind of stress and problems and are trying to work through. We need to recognize that burnout has increased with the pandemic. It's a fact. And that the wellness efforts that were starting to be ongoing back a few years ago have been somewhat delayed and limited because of the need for systems to kind of put a little of that culture and wellness issue they had started to focus on a little bit to the back burner while they try and deal with the finances and survival. But we are going to come out of this. And ultimately, the COVID pandemic is going to stimulate systems to change the cultures to some degree, and we need to be ready and working towards that. We need to recognize that there were problems that happened with staffing and space and PPE and all those things. We also know now staffing is becoming an increasing problem and how we're going to deal with that. But there are things that we've learned that we can keep, things we want to get rid of, things we need to change. It is going to be a process, and it's going to take some long-term reflection to get there. But all of this does have a very important thing, which is there's hope and expectation that this will occur. And this wellness issue, once again, I can't emphasize, needs to be embedded in the mission of the system if we're going to succeed at this. So in conclusion, this is my slide, which says, it's a new day dawning. The bad news is your flight was delayed, but the good news is you are still the pilot in your system. So land where you can make a difference in this new normal. So hopefully I've given you some ideas. I look forward to the other two speakers.
All right, so I just took a second to get my slides up, and thank you so much. What a great presentation. And I come to you as they asked me to present kind of a system approach and what we did and have done and are still working towards. I come with great humility because this is an area where I think if there's a health system out there who has this perfect, I definitely want to talk more to them because the challenges are great that we face every single day. So I've used this slide before, and I keep it as a reminder of the journey that we've been through so far, because the initial pandemic we kind of relied on and were able to have the additional support from a community perspective that quickly went back to business as usual for other people. But from a healthcare perspective and a health system perspective, there's a long-term effect of this pandemic that I think Art has done a great job of sharing with you already. So from a workforce support standpoint, I think that I put this slide up here only because I don't think you can forget that safety in a pandemic is critical. And if you don't have the elements of safety in place, then all of the support that you can provide is likely to go unnoticed or not be effective. And so it really does have two edges to it. And so these are no different than anything that you've seen before or other organizations didn't do as well. I think for the West Virginia, for the Charleston Area Medical Center, we had the benefit in the first waves of the pandemic of being able to watch it come towards us. So while you knew the wave was coming, you at least were learning what other people were doing, what other things were going to be needed. So we had an opportunity to initially prepare maybe a little bit better and learn from others as they had gone through it. I think that we've all gotten into a habit of sharing more, learning more, and to the point earlier about some things will change and some things will stop. I do hope that this new change of sharing information and really staying connected continues because we learn better and are better together. So I won't go through each one of these, but just to mention up front the impact of making sure that your workforce is safe up front. So we do a lot in healthcare, looking towards the Institute for Healthcare Improvement to guide us and to provide a framework. So I did place this in here just to say that this, as far as looking at promoting mental health and well-being, and specifically related to the pandemic and COVID-19, many of us in healthcare, and especially academic medical centers, had already started a lot of this journey prior to the pandemic coming on board. With expectations for graduate medical education, I would say they really gave us that first push of you need to be looking closer at your workforce, at those providing the care, and making sure that you have measures in place to ensure their ability to be resilient. I think wellness probably was the first words that most of us were used to, and now we've moved more towards resiliency and well-being. And so I think probably what I would say to this slide, because there are many great points from an individual standpoint, taking days off, avoiding the publicity and the media coverage, receiving some mental health support during and after a crisis, and then the leaders, training your managers to be aware of key risk factors, limit staff time on site and on shift. And yet during a pandemic, and now with the current issues that we have in healthcare with staffing, the ability of nursing to leverage themselves and not not just nursing now, it's many professions that are leveraging themselves in this new era of multiple positions available. This becomes even more challenging, because how do you do this and also sustain the ability to provide healthcare to a community that depends on you to be available and ready for them when they need you? So what are some of the things that we have done? I think Art spoke well to the transparency and the ability to provide structured communication and that access and that availability of leadership. So I will not say all of these came for us initially. These are some from what we learned from others, and some were hard lessons that we have learned ourselves. And you can get stuck trying to beat yourself up over things, or you can say, we can be better and we will make these changes, and you can make sure that you have them in place for the future. And so that would probably be a lot of what you see here as the journey. But we did have structured communication processes, whether it were huddles to the frontline staff, manager information sessions. Initially, those were as new information came out. And then with each wave that we have gone through, we've recognized the need to have a weekly checkpoint. While everyone can't be in a command center, your managers need to be able to speak to what's going on there. So having those information sessions, and then having open forums. Open forums can be challenging and can be concerning for anyone during the best of times. And then when you're in the most of challenging of times, even probably a lot may shy away from that. But I do think as leaders, it is our responsibility to be available to those at the front line, to hear what they have to say. They often have solutions that we need to be listening to and acting on. And they also know what the greatest, what I call them is the pebbles in the shoes, but the things that keep them from being able to do the work that they do every day. So we did prepare weekly huddles for our leaders. And while sometimes those weekly huddles had a clinical focus, we did make sure to always at least every other week, or maybe at least once a month, and depending on what time of year it was, to include in those huddles some portion of a well-being message. So whether it was taking care of yourself, whether it was staying safe through the holidays, taking care of each other during crisis, taking care of yourself during a crisis, managing grief. We heard a lot about working through grief earlier. So again, helping others with grief was another. And so we just consistently listened to the workforce and identified areas where we recognized they were having challenges, and then pulled information together so that the managers could share that. Did multiple focus groups with different portions of the workforce so that we could hear what they were saying. Leadership rounding continued. I would say that is critical if you're going to be successful in these times, is being visible, and even to the extent of perhaps even being out there with them if you're in a clinical role, and working with and side by side some of those people. I've been picking up shifts in our emergency department, taking care of patients, and I think it is a piece of how we ensure that we stay connected to the work that the workforce does. Huddles with Heidi, that is something that I do, but I do this once a month with frontline staff. And I was doing it before the pandemic. It certainly came in handy after. We did have to move it to Zoom. But the great thing about Zoom is it allowed for a much larger forum. Before we were doing it in rooms, and this moved it to a much broader base. And again, it's extremely transparent, and they know they can ask me anything. And I may not always have the answer. I might have to get back with them. But if I know the answer, I'll be very transparent and give it to them. And I think that's been a real success for us with the workforce. In any time in healthcare, we love to come up with our own ideas. And then there are also times when you see what other people are doing, as I mentioned, and then you still shamelessly. So our going home checklist was something that we did implement and put up throughout the hospital. And you would still see these because we're not out of times where these things are needed. And I think a lot of these go to points mentioned earlier, but taking a moment to reflect on the day, acknowledge one thing that was difficult and let it go. Be proud of the work that you did. I think that there's so much right now. We've done a lot of work with our leaders to help turn the way people see things from, they'll come to you often with only the negative, and helping them identify with even one thing that they know made a difference for a patient today. That value and that meaningfulness and the work that we do is critical when we go home. I don't want to go home and think about all the things that I didn't do. I'm going to do that anyways. Help me connect to the things that I did do well and the people that I did help. checking on colleagues before they leave, making sure that they're okay and letting them know that they had support available, and then making sure that they knew that we wanted them to focus on home, the people that were there waiting on them, and have the ability to recharge because it is so critical. Oops. A few additional things. So making sure that we had well-being, peer support, and pastoral support readily available to all workforce. Thank you notes, and they, when I send a thank you note, to the point earlier about value and meaningfulness and well-being, we'd have leaders send us pearls about any people they wanted to recognize, and wanted to make sure that it was something more than just, hey, good job, or I'm glad you're here, but really give me a scenario, give me something that I can tell them why they're making a difference here, why they matter, and was very successful. We did provide, similar to many health systems, and we still do, meals for our COVID units, snacks for all of our units. We focused very much on things that we knew would be energy, fueling, and healthy snacks, making sure people had scrubs, again, getting back to that safety as well as support. A lot of social media, TV, billboard appreciation segments. If you've been in this, if you are in healthcare, you'll learn that a lot of these things are becoming to be old. So we're constantly having to look at what's that next wave. How do we dig deeper? Because don't buy me a pizza, don't put another sign up. You're starting to hear those kind of things. So we've got to keep digging deeper into what are those things. And a lot of it's in the next layer of making sure that they have the emotional, the social, the professional, the physical, the financial, because to that point, true resilience, each one of those needs have to be met. And then everyday courage for extraordinary times. We are looking at, and that is a Joe Tai, if you haven't seen that, a reference, but there are a lot of resources there for well-being and resiliency. So we're currently working on building those into our well-being site. So this is just a picture, and then what you would do is click on each area, and it provides links easily for anyone to get to. This is on the front page of our intranet, and so all you have to do is just click if it's emotional, if it's social, professional, physical, financial, and then all of the resources that are available to anyone in the workforce, and to that point, to families as well, are all listed there so that we can make sure that people can stay connected. It's still hard because you can put all this out there, but somebody has to pick it up. So again, getting back to that point of huddles, our huddles are very specific because they'll tell the manager, pull up the well-being page. Make sure people know where it's at. Make sure they know where these resources are. And that sounds very much, micromanaging, but unfortunately, this is the level of detail that you need to get to really make sure people recognize the access that they have, and that you can provide that level of support. We've come a long way, not all the way. And so I love Dolly Parton, so I just put that phrase up there, but don't get so busy making a living that you forget to make a life. I love that. These are my reasons, and I appreciate you all allowing me to share just a little bit of our journey, and I'll turn it over to Matt.
Thanks, Heidi. Really appreciate the opportunity to get to work with you folks here today, listening to our other speakers, and having an opportunity to speak with folks that are in healthcare administration. You've picked a great time to get educated in healthcare administration because adversity is probably the focus. If that's the program focus, then you're in the right place. But just to kind of close this loop on some of the things that have been put in front of you here, I have a couple definitions that I'd like to start with. Talking about caregiver, first and foremost, according to Merriam-Webster, that it's a person that provides direct care. I apologize. My dog is at work with me here today. Hang on one minute. Animals are part of well-being. I apologize there. But I'm a big believer that there really are, just caregivers in this world. President Carter's wife really said it best, that there are only 4 kinds of people in this world: those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregivers. Caregiving is universal. And I really, really, truly believe that, because almost anyone that you speak with has been impacted by a caregiver at some point, whether it was in their own upbringing or seeing their parents, grandparents, loved ones taken care of, or themselves as a person. So caregivers are also kind of the first folks that I think about when I'm thinking about resilience, because generally speaking, if you're providing care, you've probably had to be resilient, or if you're responsible for those that are giving care, resilience is so important. And resilience is truly the capability of a strained body to recover its size and shape, or an ability to recover or adjust easily to misfortune or change. I really like that second definition that's straight out of the dictionary. Misfortune or change, is everywhere. And in healthcare, there are preventative measures that you see folks getting taken care of, but more often than not, when folks are consuming healthcare or involved in the healthcare system, they probably had some sort of misfortune or change in their walk of life that's requiring some sort of bounce back. I pose the question of, are caregivers naturally resilient? Folks that are in this program, or folks that are speaking here today on this panel, I would say they probably, when they were making a decision to actively get involved in healthcare, the question has to be posed of, are they naturally resilient? They might not even realize that you chose to be in such a position of influence that you have to be resilient, because things are constantly changing shape. Adversity is always throwing you that curveball, and you have to be prepared to bounce back. You have to truly be prepared to take something that is the best laid plan and be prepared to jump back and respond in a manner that sets you or the people you're responsible for up for success, because the only constant is change there. And caregiving in the healthcare setting, it's in perpetuity. The particular area that I'm involved in with long-term care or post-acute care, you're constantly putting one's needs before your own or your family's, day in, day out. You're taking care of the same people over and over and over again, and that can be very stressful and lead to burnout. Prior to the COVID pandemic, burnout was amongst the highest reasons for turnover in the post-acute and long-term care settings. I think oftentimes when we're taking care of people, we don't realize that when they come in to punch in and start their shift, that they're going to punch out and perform those same exact duties for loved ones at home, whether it is their own family, or whether it's an elderly neighbor, or somebody that has some sort of adversity in their life, and they might not be as resilient as the caregivers that are on this Zoom today, or those that work in our facilities. I've found that over the last decade plus, that caregivers without resilience as a character trait, they aren't going to make it very long. So if you can really focus as a point of emphasis in your screening processes and in your rewards processes, look at resilience, and those that have that trait are going to really be set up to be more successful. And those that don't have it are very quickly going to find that healthcare might not be the best walk of life for them. However, during times of crisis, even the most resilient caregivers' resolve can be tested. So I'm sure Art and Heidi would attest to this as well. I know I can say I like to believe I'm a pretty resilient guy, but in the throes of COVID, when early on, when no one was sure, how does it transmit? Is it going to survive if it's on a surface? How long can I be within 6 feet of one another? All of those questions were popping up, and even the most resilient person could say, how do I guide and shepherd the folks that are in my care, or the employees that I'm responsible for, to a place where they can be successful and safe? COVID-19, it truly has pushed folks to the brink of breakdown, to the point that individuals have left healthcare in totality. And I think really using this time in our society to find a way to stop those people from, getting so burned out and having those moral injuries, to be able to let them know that you are doing the right thing, you're doing the right work. We have to make sure that we recognize those folks. So little bit of a case study for us.
Matt, if you can advance your slides, we're still on the caregiver slide. I think it's either frozen or you haven't advanced.
Okay, I think, how's that? Did it?
We're still on the caregiver slide.
You find it?
Matt, try unsharing and then resharing on the appropriate slide. Sometimes that frees it up.
Okay, apologies. You see it now? How can we help our caregivers sustain?
Still showing a caregiver according to the Webster.
Okay.
Try sharing your screen and not the PowerPoint.
There you go.
All right. Sorry about that. That's the problem with 3 screens. Even when that's the only application. That's just a little bit of adversity. I appreciate everybody being resilient there. So just a little bit on the case study that we had here in our organization. Early on in the pandemic, much like Heidi said, we had an opportunity to see other folks, what their approach was to responding to the pandemic, and some of the things that they put in place to encourage wellness and well-being. We put together a task force of our folks and asked our caregivers, our direct frontline caregivers, how can we best help you and your families during this time so that you can continue to be your best self while taking care of customers? You wouldn't necessarily think that you have to ask that question, but I'm so thankful that we did, because we wouldn't have gotten some of the feedback that I expected. The answers really covered every topic that you can possibly think of, but amongst them, the themes that were really prevalent with most of our folks that were in here day to day allowed us to create a survival guide. So we kind of focused it on that. We used an intranet, we used the communication with direct supervisors, but we used that resource guide to come up with some things that I wouldn't have personally thought as a healthcare administrator would make a big difference. But boy, am I thankful that we did it, because things such as a dress code, you really don't realize that when you're expecting somebody to come in their uniform every day, how big of a burden it can be if they can't get to the laundromat, if they can't get somebody to come fix their washing machine because they're here 12 to 16 hours a day. So one of the things that we did right off the bat was we relaxed our dress code. We made every day dress down Friday. Folks that wore scrubs, we gave them an extra set so that they would have those. If they didn't wear scrubs, then we allowed them to wear our organization's t-shirt and jeans or any sort of scrub bottoms. At that point in time, everyone was locked down, so there wasn't anybody coming into the buildings anyway, so comfort was important. We wanted to make sure that folks had free meals while they were on the clock. Meal prep was a big deal, so we wanted to ensure that if they were here working 4 to 12 hours a day, that they had 1 to 2 meals a day. Making sure that if they had to go home, that they took some snacks with them so that they could feed their kids while they were watching TV that evening or that morning. Another big item that I didn't initially think would make a major difference, but I'm so thankful that we did it, was the focus on mental health. We have an employee assistance program in our organization that will provide expert advice on any issue. It doesn't have to be pandemic related. It could be family, it could be money, it could be health. Everyday life, just questions. There are counselors that are waiting on the other side of the phone that can help folks make those important life decisions if they want to have that conversation. We also ensured that we had access to a licensed counselor and psychologist so that folks that were going through this on a day in, day out basis had somebody that they could talk to. Early on, it was just through Zoom. Once there was a handle on the pandemic, We were able to create some group settings so that folks did have an opportunity to grieve, allowed folks an opportunity to admit that it's okay to not be okay. We continue to provide that for our folks. And then the physical health, we wanted to make sure that our folks had access to telehealth so that wherever they were, whether it was at work or whether it was on the job, that they could step into the break room and have a conversation with a licensed provider that can take care of their basic health needs. And lastly, we provided some COVID-19 paid time off. We gave folks 2 weeks of paid time off if they were going to have to take care of a loved one, whether it was somebody in their household or somebody in their extended family, or if they were the ones that were diagnosed with COVID-19. We didn't want them to have an opportunity to have that 2 weeks of time where they couldn't work and they didn't have a paycheck to take care of their family. So what we learned is remove all those obstacles, and it really allows your talent to focus on what they are truly talented in, and that's taking care of people. Remove that stress of caregiving so that folks can focus on caring for people while they're here. It really created a sense of community when we listened to our people. So as healthcare administrator students, I encourage you, just ask. You might think that it's a very elementary question, but ask, what can we do? How can we help? What are the hurdles that you're running into? And as I said before, we perceived minor details, lunches and relaxation of dress code, and that provided such a lift in morale because folks didn't have to go home and wash that single uniform that they had. That made a major difference. And remember, everybody has a breaking point. So even your most resilient employee has a breaking point. So somebody that you think they're super steady and nothing ever phases them, ask them if they're okay. It makes a major difference to ask if everybody on your team is okay, even if you think they're always fine. And I am a big believer that employees generally don't care to know about anything until they know that you care. So make sure that they know that you care for them, that you care for their family. Let them know that they're appreciated. Give that gratitude during these times of crisis. And that's all I got there.
So with that, we have a few minutes. I'm going to open it up. We have one question that we got, and we'll have to do this very quick so we can finish up by 1 o'clock. Art, you talked about moral injury, and I know in hospitals we've had to go to crisis centers of care, long-term care facilities had to shut down visitors, which are critical to patients. So how can you overcome moral injury with leadership? So Art, I don't know if you want to take that first, and then Heidi and Matt, if you had any comments on that as well.
Sure. I think that as I sat here and listened, and Heidi said, she wished she had some examples of really quality programs to go to. I think listening to the two other people on the panel today, they put together some pretty quality ideas of things that I see here that you don't see all around the country at this point. And I think the way you deal with the moral injury, it isn't a permanent problem. It's recognizing that that's the kind of suffering that's going on for you individually from what you're seeing. And these type of programs that were just talked about are the things that start to overcome those things so that individuals aren't seeing leadership doing bad things and all the things you heard about in the press and other things. It's simply really, it's that human factor that got talked about with the gratitude and putting in place programs that they know they can feel safe in and get the help that they need. And those are the type of ways you overcome that.
Heidi or Matt, do you have any comments before we wrap up?
No, I think it was very well stated. I think that if you stay in tune to this from a system perspective or for the workforce, then to apply that to yourself as a leader, it makes you much more in tune to recognizing what you need for yourself. So I think that we have to stay strong for them, but we're also human. So I think that there's a lot of what was shared today. I run my own self through those checklists every single day, just the same, and look for signs.
So with that, it's almost 1 o'clock, so let me wrap up. Before I turn it over to Eric for final comments, I just want to thank our organization who helped us identify folks. I got to thank the West Virginia State Medical Association who connected us with Art, the West Virginia Healthcare Association, who connected us with Matt, and the Hospital Association, who connected us with Heidi. Thank you to all three of our panelists. Greatly appreciate your time in putting this panel together. Great information, great comments. With that, Eric, I'll turn it back to you for closing comments and discussion on CEUs.
Great. Thank you, Jim. And thank you, Art, Heidi, Matt. What a wonderful presentation. You probably see in the comments how much people have appreciated. I'm getting a lot of private messages too. This has been a great talk. Again, these administrative ground rounds will be held on at least twice a year basis. We'll continue working to identify topics that are meaningful to those in administrative roles throughout the state and region, and are grateful to those who have helped support today's event, and to our partnership, especially with the State Hospital Association, and Jim and your team. Thank you. For those who are impacted by this or interested, this session has been approved for 1 hour of qualifying education credit through the American College of Healthcare Executives. That is a self-reported continuing education credit. If you have any issues about entering that, please let us know. You can get support through the ACHE customer service, and there's some information in the chat. This is being recorded. We'll have it posted to our website soon, and look forward to seeing you all at future administrative ground rounds. Have a wonderful weekend, everyone.